Welcome to another video of Zilla. In this video, we're gonna talk about the basics of goiter. The purpose of Team Zilla is to aware the public about the common diseases. You must stay aware to stay safe. Your thyroid is a gland found in your neck, just below your Adam's apple. It secretes hormones that help regulate bodily functions, including metabolism, the process that turns food into energy. It also regulates heart rate, respiration, digestion, and mood. A condition that increases the size of your thyroid is called a goiter. A goiter may develop in anyone, but is more common in women. Sometimes, it affects the way the thyroid functions. The primary symptom of a goiter is noticeable swelling in your neck. If you have nodules on your thyroid, they may range in size from very small to very large. The presence of nodules may increase the appearance of swelling. Other symptoms include difficulty in swallowing or breathing, coughing, hoarseness in your voice, and dizziness when you raise your arm above your head. Iodine deficiency is the main cause of goiters. Iodine is essential to help your thyroid produce thyroid hormones. When you don't have enough iodine, the thyroid works extra hard to make thyroid hormone, causing the gland to grow larger. Other causes include Graves' disease, which occurs when your thyroid produces more thyroid hormone than normal, which is known as hyperthyroidism. The excessive production of hormones makes the thyroid increase in size. Hashimoto's Thyroiditis. When you have Hashimoto's Thyroiditis, it predisposes thyroid to not being able to produce enough thyroid hormone, causing hypothyroidism. The low thyroid hormone causes the pituitary gland to make more thyroid-stimulating hormone, TSH for short, which causes the thyroid to enlarge. Inflammation. Some people develop thyroiditis, an inflammation of the thyroid, that can cause a goiter. This is different than Hashimoto's thyroiditis. One example is viral thyroiditis. Nodules. Solid or fluid-containing cysts may appear on the thyroid and cause it to swell. These nodules are often non-cancerous. Thyroid cancer. Cancer may affect the thyroid, which causes swelling on one side of the gland. Thyroid cancer isn't as common as the formation of benign nodules. Goiters have many causes. As a result, there are different types. These include colloid goiter, also called endemic goiter, which develops from the lack of iodine, a mineral essential to the production of thyroid hormones. People who get this type of goiter usually live in areas where iodine is scarce. Nontoxic goiter, also called sporadic goiter. The cause of a nontoxic goiter is usually unknown, though it may be caused by medications like lithium. Lithium is used to treat mood disorders, such as bipolar disorder. Nontoxic goiters don't affect the production of thyroid hormone, and the thyroid function is healthy. They're also benign. Toxic nodular or multinodular goiter. This type of goiter forms one or more small nodules as it enlarges. The nodules produce their own thyroid hormone, causing hyperthyroidism. It generally forms as an extension of a simple goiter. You may be at risk for a goiter if you have a family history of thyroid cancer, nodules, and other problems that affect the thyroid, if you don't get enough iodine in your diet, if you have a condition that decreases the iodine in your body, if you are female. Women have a high risk for goiter than men if you are over the age of 40. Aging may affect the health of your thyroid if you have radiation therapy in the neck or chest area. Radiation may change the way your thyroid functions. Your doctor will decide on a course of treatment based on the size and condition of your goiter and symptoms associated with it. Treatment is also based on health problems that contribute to the goiter. Medications. If you have hypothyroidism or hyperthyroidism, medications to treat these conditions may be enough to shrink a goiter. To reduce your inflammation, medications like corticosteroids may be used if you have thyroiditis. Surgeries. Surgical removal of your thyroid, known as thyroidectomy, is an option if yours grows too large or doesn't respond to medication therapy. Radioactive iodine. In people with toxic multinodular goiters, radioactive iodine, RAI for short, may be necessary. The RAI is ingested orally and then travels to your thyroid through your blood, where it destroys the overactive thyroid tissue. Home care. Depending on your type of goiter, you may need to increase or decrease your iodine intake at home. But if a goiter is small and doesn't cause any problems, you may require no treatment at all. If your goiter is caused by your diet, these suggestions can help to prevent goiter. Get enough iodine. To ensure that you get enough iodine, use iodized salt or eat seafood or seaweed. Sushi is a good source of seaweed and should be used about twice a week. Shrimp and other shellfish are particularly high in iodine. If you live near the coast, locally grown fruits and vegetables are likely to contain some iodine too, as are cow's milk and yogurt. Everyone needs about 150 micrograms of iodine a day. This amount is slightly less than half a teaspoon of iodized salt. Avoid excess iodine consumption. Although it's uncommon, getting too much iodine sometimes leads to a goiter. If excess iodine is a problem, avoid iodine-fortified salt, shellfish, seaweed, and iodine supplements. And with that, I want to thank you for watching. I hope you found this video useful. See you in another video. Stay aware and stay safe.